Have you ever had a problem with dry mouth? Vitalis Ogola is my name. I'm a dentist based in Kisumu. I'm going to handle that topic for you today in partnership with Ponea Health. Is there a permanent cure to a dry mouth? Dry mouth is not one of the most common problems in our society. So it's not one of those things that I would say that the causes are common. But the main way in which we manage dry mouth is to remove the cause. In some cases, the causes cannot be entirely removed, like if you have radiation because of cancer, chemotherapeutic drugs. That may not be stopped, but normally for those kind of cases, it's for a period. If your dry mouth is as a result of drugs, certain drugs cannot be stopped, but there are alternatives which you can discuss with your physician, so that if you're on antidepressants, then if it's for long-term use, then you can be given options which could reduce it. For people who entirely, and then there are people who don't hydrate well, those ones, if you continue hydrating often, drinking water, then you'd probably have a long-term solution. But for the bulk of the population of people who now have a dry mouth that is recurrent or constant, then they are artificial saliva. Artificial saliva is just, they come in pastels, sort of lozenges, like people know Vicks or things like that. Then those lozenges you can be given to swallow. So they line the cheeks, along the lining of the cheeks, to keep more moisture in the mouth. That is one of the more long-term things that would give one to use. Then there are mouthwashes, which are more inclined, are largely used for people who have dry mouth, to keep your mouth moisturized. But it's not something that, it's not a one kill solution that I'll tell you, take this drug and then you forget about it forever. But it's something that you can manage routinely to ensure that you manage your dry mouth. Is dry mouth indicative of a severe dental condition? Not largely, to show that dry mouth doesn't largely show you that you have a dental condition. Mostly dry mouth leads to a dental condition. But dry mouth mostly is an indication of a systemic general problem. Systemic to mean that it is a problem that is within the body, like you could be having a problem elsewhere that manifests through a dry mouth. Dry mouth by itself is not a disease. It is a symptom. The way you have a headache from malaria is the same way you could have dry mouth because your salivary glands are not producing enough saliva. And mostly, when your salivary glands are not producing enough saliva, because it is a liquid, it also manifests in people having less mucus in the nose, less liquids within the general system. You have your skin being more dry. So a dry mouth is more of a manifestation of you having a systemic problem which needs to be noted. Then, of course, the net effect is that you end up having problems within the mouth. How can one prevent a dry mouth? You can prevent a dry mouth by avoiding some things. If you smoke, find a way to stop the smoking, because smoke is one of the things that lead to people having a dry mouth. If you don't hydrate well, if you don't drink water as you should, then drink water frequently within the day so that you can avoid having a dry mouth. If you're sick, of course, there are certain drugs that you can take, but avoid abusing some drugs. More commonly, the people who misuse antihistamines, things like celestamine, Piriton. They're meant to reduce moisture within the system so that you don't produce mucus. Don't abuse them. Avoid taking things which have a lot of sugar, salt, acidic things, because those reduce, if you remember the chemistry that you did, they tend to draw more water away from the mouth. And then, of course, there are people who have mouth breathing, which I was forgetting about. People who breathe through the mouth end up developing dry mouth. So then sometimes the symptoms are people who snore. They need to seek medical attention so that that can be addressed to prevent them from having dry mouth. But generally, the main thing you should do is to have a routine medical check, not just dental, so that we eliminate any other problem that could put you at risk of having a dry mouth. Thank you for taking your time to listen in to the information that we've shared. We are grateful and hope that you've learned something from us. Should you seek to get our services, we at Royal Dental Clinic in Kisumu, Homa Bay, and Migori. Feel free to reach to us through ponea.com, which is a platform that enables you get to us. And beyond this, there are many topics that will come your way in dentistry and others through Ponea in other episodes.